function, we know that there's at least how many segments involved with that? Three or more. At least 3, definitely. So, on page 306. Thank you very much. On page 306, we have a neutral dysfunction, and it's side bent right, which means it's rotated. If it's neutral dysfunction, if it's side bent right, it's rotated. And is it easier to see the side bend or the rotation of a type 1? It's easier to see the side bend. Is it easier to palpate the side bend or the rotation of a type 1? It's easier to palpate the rotation. It's easier to see the side bend. Visually, if someone were standing here doing a postural screen, you will be more easily able to see the side bend of a type 1 than you will the rotation. When you're palpating, you're able to palpate the rotation more easily than the side bend. So in this technique, Dr. Greenman again is working from the right side to correct the right side bend. So he actually is reaching across the body from the back. He also implements that weave technique to help gain more control over his patient. So if I could just have somebody, Lauren, come on up. Right. Now he's not really giving any specific levels to his type 1 dysfunction. I think in the T-spine he did. So what we're going to just assume is that it's, let's say, L2, 3, and 4. Okay? So if it involves 3 segments, and I have to help translate or correct that side bending by making contact at the apex of the curve on the convexity, if it's L2, 3, 4, where do I need to be with my thumb? At L3. And if she's side bent to the right, which side of the curve do I need to be doing my force from? The right side or the left side? The left side. Because what I want to do, exactly, Eric, I want to come here and I want to block that curve here and translate her this way, so that as I translate her towards the right, I'm actually creating a moment of side bending left. All right? Now, if she's side bending left, to correct the type 1, do I rotate her left? I have to rotate her because she's already rotated left. Correct? Yeah. So what we want to do, we're going to do the weave technique. So your hand is going to be right here on the left side. You can see that okay in the video? So the weave is I'm going to come up and then over. So my arm is going to come from below through her contact here and then come up onto her other knee. Okay? Thanks. I'm going to contact L3 because we all agreed that, you know, we'd name it because it wasn't named for us. 2, 3, 4. So I'll be on L3. What I need to do is I need to come in here and I need to side glide or translate towards me, causing side bend left. And is it important that I keep her neutral, or could I just get sloppy and go into extension or flexion? Got to keep her neutral because it's a neutral dysfunction. If I bias it with flexion or extension, I'm not going to be able to address the type 1 dysfunction. So I'm here, translate her towards me, causing side bend to the left, and I can now implement right rotation. Okay? With the help of my hand and my trunk, resting against her trunk. And all I need to do is ask her to try to side bend to the right. I'll block her, and at the same time try to rotate left. Hold, 2, 3, 4, 5, relax. I take up more side bending with translation, so I keep her over her center of gravity, and I further rotate her right. One more time, try to side bend right and rotate left. So I block her with my trunk and I block her with my hand. Hold, 2, 2, 3, 4, 5. Relax. Further translation, further rotation. And I can't get sloppy and drop her into flexion, because that will be the normal tendency to do that just with this position. And then I can come back and then reassess her after the treatment. Okay? Eric?
Yeah, I'm not sure if this is something you said earlier. I'm not sure if this is something you said earlier. When we were assessing, when we were trying to gap in neutral,
Yes.
you didn't want us to induce too much rotation,
Right.
because you thought it would take us out of neutral.
Yes.
Aren't we trying to stay neutral here, so when we just keep the translation going?
The way that what would have happened, the difference in that other technique was my contact. I was controlling everything from right here.
Okay.
So if I went into rotation, look how easy it is for me to pull her into some extension. This way I'm blocked and I'm closed. And it just happens to be the way that that's how Phil Greenman depicts it. But that's the difference that I would offer in response to your question. If I'm here, I'm going to have more of a tendency to run the risk of coming back into extension if I do the rotation. That's why I want to be conscious more with the translation for the correction of the FRS. All right? Plus, with that correction, remember what is most important, to gap. To gap. Because once that side is elongated as far as it can go, comfortably, then the rotation can come through safely and close on the right. But that's different than the neutral correction. Now, you know what? I'm not going to show alternatives. Let's go and do this, and then we'll clean up and